Hi there, my name is Gerard Greene and I'd like to welcome you all to our podcast and video blog, and I'm delighted on World Menopause Day that we have two very special guests with us. We've got Jane Lewis, who has recently published her amazing book, Me and My Menopausal Vagina, which has also recently won an award that Jane can tell us about. So it's great to have Jane here. And we also have one of our own brilliant women's health physiotherapists, Fiona Mitchell, who's based in the clinic here in Birmingham. And it's great that Fiona and Jane have been able to fit this into their busy schedules. So I'd also like to thank all the people who have submitted questions for Jane and Fiona to answer, both women on social media and some patients of ours here in the clinic in Birmingham, and also some of the wonderful women's health physiotherapists both in the UK and internationally who've sent us questions. So hopefully by the end of this we will have answered those questions, or at least maybe created some more discussion around them. So I'd like to kick off really. So Jane, I've read your book, yes. And I've also got my wife has read it, and some of my wife's friends read, and it's generated a lot of discussion. And I think one thing that's really highlighted in the book by yourself is the importance of women getting comfortable using normal anatomical terminology.
Yeah.
So would you like to say why you feel that's important to you?
Well, firstly, women either say my vagina hurts, and it's not their vagina at all, it's their vulva. But if we keep using words like down there, my foof, my fanny, all these words, which I know we see them as a fun thing to use, but it's teaching our daughters not to use the words correctly, and it makes it almost like a shame thing to say the actual word. And when they have a problem later in life, potentially, or teenagers, some teenagers go to the doctor not actually knowing it's called a vagina, they think they've just got a foof. And we have to be able to talk and use these words correctly, because if we carry on being shameful about them, then all these problems with our women's health won't change. We have to be, it's just like your knee or your feet.
Yeah, so we need to get rid of that taboo possibly.
Yes.
And in your book, you talk a lot about vaginal atrophy.
Yes. Yeah.
And can you maybe tell us why that is a condition that may be linked to that menopausal period?
Yeah.
And maybe what is it?
Yeah, well, they know that roughly 50% of all women will get vaginal atrophy in some form, whether that may be just getting up to go to the toilet 2 or 3 times a night, or a bit of soreness, or like myself, I have just about everything wrong. But they feel that statistically it's nearer 70 to 80% of all women, but only roughly 7% of them go to their GP, purely because they are embarrassed about the problem, and it's just due to a lack of estrogen. Basically, our skin starts to dry. A lot of us get itchy skin, which is called formication, and our ears can itch, and our eyes, our nose, our mouths can dry, and they are the mucosal membranes, and our vagina and vulva react in just the same way, and it becomes thinner and shorter and more fragile.
And Fiona, here in the clinic, you and your other colleagues see a lot of these women with vaginal atrophy. Mm-hmm. And so what are the main things that these women are complaining of that you see?
Okay, well the first thing I'd say is that generally people don't tend to come in with vaginal atrophy. You know, they're not coming in saying, I've got vaginal atrophy. What they come in with is a myriad of issues, as Jane says, whether it's stress incontinence or an increase in frequency, painful sex, just irritation, pelvic pain, problems with scar tissue maybe that they had from an episiotomy or a tear when they had the babies, and then going through the menopause those tissues are changing because they're not so plump and they're starting to cause problems then. So it's normally that we pick up that people are having, that are developing or have vaginal atrophy, rather than the fact that they are coming to see us specifically with that
quite often they don't realise, do they?
No. A lot of women think that the symptoms that they are getting are normal, you know, and I think that's probably why only a small percent go to the GP in the first place, because they just think they've got to put up with the soreness, the irritation, the dryness.
They don't look, do they?
No.
So they haven't, no.
And I know from, you know, chatting to you, Fiona, and chatting to some of our other colleagues here, is that we tend to get women coming to the clinic when they may be in a real crisis, when things have gotten really bad, whether that's their pelvic pain, whether that's their urinary symptoms. So people tend to maybe find us when things are really bad. But in the book, Jane talks about the early warning signs of maybe that there's a pelvic health problem. So can maybe both of you tell us maybe what some early warning signs that something may be wrong are, that maybe women could look out for, so that they don't have to leave it to crisis point to get help?
Well, for me, the reason I came to see Fiona and started the physiotherapy route was sex was painful, and we had to stop having sex. I was getting stabbing pains in my vagina. I was very sore. I was going to the toilet a lot. And I then realised that my vagina had become what they call shorter and tighter, and I had physiotherapy, but we realised quite soon on that no amount of physiotherapy was going to cure that on its own. It's a multidisciplinary thing, and I needed estrogen, and once I got my estrogen up, and my local estrogen, then the pelvic floor started to relax, to be able to have work from physiotherapy to then carry on.
And then Fiona, are there any things that you might suggest that might be something that women could pick up early on, that things may not be right in terms of pelvic health?
So we're not just looking at postmenopausal or perimenopausal, postmenopausal women. You know, there's a lot of women that can suffer from vaginal atrophy or vaginal dryness, and that could be after giving birth, or if you're on the birth control pill, those can lead to dryness, chemotherapy. So I think just realising that your vagina and your vulva becoming drier are maybe some early warning signs. And again, you might start getting those few symptoms, but the thing is, as Jane says, if we never check and we never look, and we don't know what our normal is with regards to how our vulva looks and the dryness of our tissues or the plumpness of our tissues, then how will we know when things change? So I think that's a really important...
You've got to start looking. When you check your boobs every month, you've got to start looking at your vulva. And it might be a bit grim at first, but my dryness, when I look back, actually happened for nearly 3 to 4 years before I had any problems. I just thought, oh, that was fine.
And I suppose that fits in well with getting people used to using that normal terminology and getting them to know their own body, so then they may be a bit less self-conscious about checking their vulva or being less kind of have less embarrassment.
Yeah, definitely.
And so Jane, I've probably got to know you first through one of the pelvic pain support groups you ran on Facebook.
Yes.
And you know, I always admired the work you did, because you were a big advocate for getting help for these men and women with pelvic pain. And you've also been a really big supporter of women's health physiotherapy and men's health physiotherapy. And I think one thing that we've discussed sometimes is that, you know, you will go to a lot of meetings of maybe medical professionals or patient groups, and most people have no awareness of what women's health physiotherapy is.
No.
So can you maybe tell us what your experience of women's health physiotherapy was? Maybe it's in relation to maybe Fiona.
Well, firstly, the ones I've met, they are all very caring and very passionate, because a lot of pelvic pain also involves the mind. You know, it's a very depressive problem to have. It's the whole body. It's not, people think they have pelvic pain in their vagina and it's just there. It is not. It could be coming. It's a bit like a tsunami. You know, that is the centre of it. It can be coming from everywhere. And just to be able to talk and unload and to be listened to and believed. That's the biggest thing, is to be believed, because we're not believed by a lot of the medical profession, because they can't physically, they look at you and say, oh, you look fine. And if you don't have the energy, because when you are so down and low, if you don't have the mental and physical energy to go on Dr. Google and search, you're not going to be directed to very often to a women's health physiotherapist, because a lot of the medical professionals don't know they exist. The private sector does more. And then you just start on a path of, it's body, mind, diet, well-being. It's the whole thing is what they offer.
So it's not just the pelvic floor. It's not just the pelvis even.
Yeah.
And then Fiona, we could probably talk to Fiona for hours about this, but we don't have hours. So Fiona, do you maybe in a snapshot, maybe what are some of the key things you do with maybe some of these women that you see, particularly maybe who've got menopausal type pelvic issues?
Okay. So obviously taking a detailed history is majorly important, because any gynecological history and probably is contributing to what's going on. So obstetric and gynecological history. But also getting an idea of what people are doing all day, every day. What's happening with their periods, their menstrual cycle, their hydration, what they're eating, medication that's being taken. And also a lot of the time when people are coming, there's a huge history, like Jane, of other things that you've actually tried beforehand as well. So doing that and getting the most amount of information that you possibly can to start off with is for me is hugely important, and sometimes more important than actually looking at somebody,
right,
or equally as important. But if that takes over half an hour to go through that history, it's just giving us some really big clues as to what's going on. But also, as Jane says, it gives somebody a chance to unload, offload, and actually be listened to, which a lot of the time hasn't happened prior to them coming to see.
So lots of talking and listening as to what's going on. And then what might some of the physical examination involve?
Yeah, so I will personally always be looking at somebody's posture through their so their posture sitting and standing, what's happening through their lower back, because if you've got any restrictions through your lumbar spine, then that can affect what's going on in your pelvis. The same with your hips, and also through your abdomen as well. So we're looking at muscle length and muscle strength, mobility, and how the viscera, the organs throughout your abdomen are actually moving as well, whether they're restricted. So all of that happens even before we enter into the pelvic examination. So and so that may or may not take place on the first physio session. It might be that there's other things that need to be assessed and dealt with equally as important, like breathing and posture.
And I think before we started the recording, we had a quick chat that a lot of people associate women's health physiotherapy with just doing Kegels. And I think the three of us know that that's incorrect, that it's much more complex than that. And do you want to just maybe tell us a little bit about that some women do need to strengthen, but for a lot of women it may be the opposite, that they need to do less with their pelvic floor.
Absolutely. So from the assessment that you've already done, you generally get an idea of what somebody's pelvic floor, whether it's going to be tight and overactive, or whether it's going to be weaker. You will tend to get more of an overactive pelvic floor if there's a lot of pain involved, if somebody's very stressed, if their abdominals are tight. It tends to tie in with having more of a tighter pelvic floor. They might even say that they're having issues with their jaw, they're a teeth grinder, they clamp down a lot, and that's been noted by the dentist, or maybe they've realised as well. So you'll get, when we do our pelvic examination, that's the time that we can note whether somebody you may have you may have symptoms of incontinence, stress incontinence, if you've got a hypertonic pelvic floor, because the muscles are so tight they can't tighten up anymore.
So they're overactive, but they're still not working properly.
Absolutely. They can't coordinate properly, the muscles through the pelvic floor, or it might be that we find that there is a weakness through the pelvic floor. And if there's a tightness through the pelvic floor, then that's as well as the work that we can do internally to relax and release those muscles off. It's also majorly important, obviously, to look at stress factors.
True.
And breathing, because we know that by breathing correctly, that makes a massive difference to our cortisol levels and our parasympathetic nervous system. So it's not necessarily all about treating the pelvic floor at that point.
Brilliant. And when I read the book last week, and my wife, we read it together, so no Netflix that night, reading Jane's book. And estrogen is mentioned an awful lot. And I think this came as a surprise to me, the emphasis on estrogen, but also to my wife. And my wife is kind of similar to my age, mid-40s. And I think she said that she, even though she's a health professional, she and her friends probably weren't aware of this, that estrogen was so important for their kind of, particularly vaginal health, bone health. So do you want to maybe tell us why is estrogen so important?
Yeah, as I say in the book, I'm not pro-HRT, I'm pro-choice and pro-education. But basically a woman's whole body, the whole body just needs estrogen. And it's becoming more and more apparent because we are now, on 100 years ago, living up to 30 years without it. And people are saying, oh, I got on in my day without it, but life is now far more stressful in general. And it's what gives us the collagen and the bounce, and the vaginal area especially, and the pelvic floor really relies on estrogen to just keep it healthy, and the bladder also, because so many women as they get older have the giggly, the oops moment, and wear their pads, and they get up 2 or 3 times a night. It's because the part of the bladder is also very estrogen dependent, and as the estrogen reduces, you are then more prone to getting infections that you once got rid of. And it just keeps scar tissue supple. Estrogen is really important. And since I've been on HRT 2 years now, my legs, which were flaking skin and so itchy, are now supple again. Without it, I've never been on a contraceptive pill. I was never going to go on HRT, but I have no choice. If I want to have any quality of life, I have to be on it. The estrogen and testosterone plays a part as well for women. It's not just estrogen.
Yeah, and you mentioned that before we started the morning. And you mentioned earlier on, Jane, that one of the things that maybe highlighted to you that there was a problem was the difficulty with intimacy. So that pain on intimacy and sexual activity. So why is this something that still in 2018 that we're not really that good at talking about?
I don't know, because it is really far more common than people realise. I'm in various groups, not just my own. And I would say on a daily basis, 1 or 2 subjects a day come up with, oh, I can't have sex anymore, or it hurts a bit, or it's this. But it's just, it is the case of put up, shut up, and lie back and think of England, or you just don't do it anymore. But when you think of all the jokes from years ago, like Benny Hill and what have you, and no more sex, and I think it was all part of it. I think it has always been there. How are we going to change it? I hope this book and all these videos that are happening are going to be the start of it.
And Fiona, is this something that normally women will come and see you, and maybe not, they mightn't, a bit like vagina, they mightn't book in because they're having pain on having sex, but is it a big thing that you pick up in the assessment?
Definitely. There's probably a few people that come in specifically because they're having painful sex. However, it's generally something that they hadn't even thought about necessarily telling you as a priority. It's almost a bit of a sideline, and if you don't ask the questions, then I think a lot of women probably wouldn't actually mention it at all, to be honest.
But when you hear the odd GP, he says have a glass of wine and relax and get on with it.
Not helpful.
Not helpful.
Absolutely. So it's something maybe that postnatally we would think that is part of that postnatal period is having painful sex, and people might talk about it then, but I don't think that women really talk about it at all later on.
And probably don't really discuss it openly with friends, or
Well, you might have a couple of
close
friends,
friends.
but maybe
No.
not huge.
I'm not normal. I'm not
No,
normal.
I'm not normal either.
I'm really,
I think we move into, it's when you move in different circles, isn't
Yeah.
it, that you talk about things quite openly, but I think
yeah.
in general, out of the physio and the circles that
And
spoken.
linking in with the book, we've had some of our physiotherapy colleagues, our pelvic health physiotherapy colleagues, and I think what they would like is maybe some top vaginal health tips that they could pass on to their patients.
Is this me?
Well, I think you can start,
I'll
James,
start.
because you've written the book,
Yeah.
and it's quite.
Yeah.
I find it a really fascinating section of the book.
Yeah. Well, firstly, there is a huge amount of money being made out of us women with all these vaginal products in the shops. A lot of them, quite frankly, shouldn't belong in the vagina, and I'm obviously not going to mention any names, but you need to look at the ingredients in these products because they don't actually have to list them all either. Not everything has to be listed for these vaginal products. So you need to do your research. Don't ever self-treat when you've got soreness and burning because those advertisements on telly really irritate me. You could have something awful like lichen sclerosis or something else. But you've got to have the best products with the least ingredients in. Organic, as where possible, but you've just got to have really good quality. Because for some reason it seems to me that we can put any old thing in there or up there that's cheap and without thinking about it, but you put expensive makeup on your eyes.
That's a good point.
You know, you've got to spend down here much more than up here, to be
Good
honest.
point.
Absolutely.
That's a good tip, actually.
If you put anything down there at all.
Yes.
So I would say, it's keeping away from these highly perfumed, even washing clothes, liquid powders as well. If your clothes smell, then there's obviously chemical involved, and perfumes, which can be adding to the dryness as well. Sanitary towels with plastic coverings. They might advertise that they keep you drier for longer, but obviously there's chemicals involved there as well. So just trying to be as natural, as Jane says, as possible. And we know that even with the pH balanced products that you can buy, they're not always, well, you shouldn't really, I would say don't use anything like that. The pH in the vagina is very delicate, and we don't want to do anything to change the good bacteria in our vagina because that can lead to issues, maybe not straight away, but even doing that can lead to issues like vaginal atrophy and bacterial vaginosis, different infections. So definitely nothing perfumed, no aggressive no aggressive razoring or waxing, or just try and treat those delicate tissues with a lot of respect, really.
And wash with water only.
Yes.
And nothing, you don't need, it does not need chronic irrigation up there. It just needs a self-cleaning oven. It just needs to be left alone. Less is more.
Definitely.
And Jane will definitely be able to answer this because Jane has many years of being heavily involved with some of the pelvic pain support groups, particularly on Facebook. That's where we kind of came across her. And now she administers and runs the Vaginal Atrophy group on Facebook. So where can women, and I've also included kind of partners and friends, kind of find support for conditions like vaginal atrophy, like pelvic pain? Where can they find some help? Because it's not easy.
No, well, my group is called Vaginal Atrophy, and it's a closed group, and it's very potluck. It seems to be with the Google search whether you can find it or not, but it is called Vaginal Atrophy. That is for women only. I think there does need to be one starting out for men, the partners of the wives or their partners, because it is very hard for them as well. But there's no way I could have the men in my vaginal atrophy group. I do know that the pudendal and vulvodynia one is different. But even ladies in the group, they're so shy to be in these groups. They don't want to.
I suppose no one wants to be in a vaginal atrophy.
No, you'd rather be in a gardening group.
That's true.
Yeah.
But it's good the groups. It's good that there is a starting point.
A starting point. It's the first one
for those women.
Yeah.
And can we see the book, Jane? Because the book is
and it's very coloured.
And the book. Do you always wear a matching top?
No, I don't know. But yes, this. I designed the book originally. My daughter said, "You're not having that, Mum," because that's what every menopause book looks like. So she was in the shower and decided on this, and the lollipop has lots of meanings. It's the shape of a woman. That's a painful vagina at the top when you have sex. That's a painful vulva. And sometimes when you're burning and it hurts, you basically want to put one up there. Not that you do, yes. But we had to get something that was, caught the eye.
Which I think it has, and I think for me personally, and for us in the clinic, because we know you, it's been brilliant to see it being shared so widely on Facebook, Instagram, Twitter, and obviously people seem to have really got behind you, which is fantastic.
Yes, they have been very kind.
I think coming towards the end, I think I've read the book and I found it really fascinating. So why do you think it's also important, and for Fiona as well, that men also read your book and learn more about female pelvic health and their own pelvic health? But why do you think men should read the book?
If they're with a woman, it affects them equally, because they're highly likely their sex life is going to potentially be affected. But even if you need to read this before these problems come. This is for all age groups. This is to educate men, because it seems to be even young girls are starting to get painful sex. I think more and more there's either more of these problems or it's being discussed about more. And men need to know that it's not okay if your partner is having painful sex. This is relevant whether it's vaginal atrophy or not. Across the board, that needs to be, men need to understand that it's not okay and to direct them for help.
Anything to add there, because you see obviously a lot of women with a myriad of pelvic health. So why do you think it's also important that the men, the partners know, are a bit more informed, a bit more educated?
I think it works both ways, doesn't it? So men with pelvic health, women with pelvic health. I think the more that your partners can understand what you're going through and the symptoms that you're having, and not only how it's affecting you physically, but how it's affecting you mentally as well, then of course they can offer you more support. I think, and again, the more we start talking about things, the more this will become more normal.
Yes. Yeah.
It needs to be spoken about more widely, and I think it starts obviously with our children, not discussing things in great detail, but using the right anatomical terms. Yeah, definitely. And then moving on from there, as they are capable of, dealing with the information that you're going to give them, as Jane says, that things aren't normal, and if their partner complains that sex is painful or that their vulva's sore, that they're not like shying away from it and thinks it's the most grossest thing ever, but actually being able to deal with that information.
Brilliant. And Jane, this is World Menopause Day.
Yeah.
What else are you doing today?
I'm off to London to be on a panel with 5 people. One of them is the chair of the British Menopausal Society, and talking about sexual well-being.
Fantastic. So I would just like to say a big thank you to all the people who sent us questions. That really helped us to form the questions for the podcast and the vlog. I'd like to thank the people who've taken time to listen to it and look at it. We hope you found it useful and informative. And big thanks to Fiona for giving up her part of her day. Fiona does amazing work with the women here. And a bit like Jane said, like all women's health visits, she's incredibly passionate about the work she does. And personally, I've seen many women whose lives she's changed, and it's just quite amazing to see. And a massive thanks to Jane, because Jane is